So I'm working over the course of that swelling, and I'm putting a little bit of pressure where she's got some of that fluid buildup, and I'm pushing it back up. What I talked about there, 1, 2, and 3 muscle grade strains, different things that you do for each one of those type of problems, and usually muscle soreness from a really heavy workout is more grade 1. Pulling something or an acute injury, think grade 2, and then complete avulsion of the muscle, 100%, grade 3. The grade 3 surgery, 1 and 2 are wheelhouse. 1, just be really smart about recovery. 2, needs treatment, and the right kind of treatment. Yeah, is that a good summary?
I think so.
Avoid nicotine, eat really well, get your good vitamins and minerals, manganese, zinc, magnesium. Rest, good proteins after you work out.
For sure.
Rest the tissue because you just created trauma to it so that it could break down and then grow again. So rest, and then a little bit more, we'll get into detail about grade 2 muscle strains after I almost pass out.
Oh, that sucker's tender.
So why are you putting compression over this thing?
Your dad told me to do it.
Dr. Jeff.
Dr. Jeff. He's the man.
So
he sent me home with an ace bandage, an ice pack.
So T gets a little bit of a klutz.
A little bit is just not even covering it.
And that's all right. We all got our things, right?
Yep.
And her thing is not ankle stability.
Nope. Especially because I've already done it once.
Oh, okay. That's a good little line to go from. So once you sprain your ankle,
more likely to happen again.
Tegan, you should be running this one. Okay. So she said you're more likely for it to happen again. So when you have a strain, you get a little instability, and then you kind of lose that ability to support, and maybe you even get a little laxity in that tissue. And with that laxity comes some, you're more prone to spraining again.
Yep.
How do you stop that from happening?
Well, you pay attention to what you're doing, for one.
Oh my, you look where you walk?
Well, I was standing still. That's the fun part.
Okay, we got a lot of work to do.
Yeah, but you strengthen.
Oh, cool. Nice. Right on. And then what do you do to help with the pain in the beginning of this acute ligamentous strain? So, go. Ice.
Ice, elevation, or price.
Price.
If you want to use, or rice, pressure.
Pressure. Rest.
Ice. Compression. What's the E?
You said it first.
Did I?
Elevate.
Elevate.
So
what I did.
Elevation. That's an acute response to that tissue. We mobilize that tissue as soon as we can in a comfortable range of motion for you. So in the very beginning, what can I do to speed up healing? Laser therapy over this tissue is really helpful. So she's getting laser therapy twice a day. That's what we're going to do today.
Okay. Did needles yesterday.
She got dry needling done. That proliferates that healing response to that tissue. So you don't have a lot of great blood flow to ligaments, which is why they take a lot longer to heal, because we get all those healing elements through our blood.
I was like, blood. I wasn't sure if I was responding.
We're doing a fill in the blank thing. I'm kind of liking it. So what else is helpful for this type of injury? So very gentle passive range of motion with compression over the tissue is helpful for recovery. So I want to with an injury like this, you get swelling, and swelling is a byproduct of that injury. So we want to allow the body to help it flush out that swelling, hence the compression sleeve, and hence this very gentle lymphatic massage work that I'm doing over her ankle. So I'm working over the course of that swelling, and I'm putting a little bit of pressure where she's got some of that fluid buildup, and I'm pushing it back up. Another way to help with that is she gets her calf muscles involved a little bit. So pull back for me, and push down. A little push, don't go so far. There you go, good. Pull back, and push down. Good. Ankle sprains, there's a lot you can do to help with them in the acute phase. We said a couple of them: dry needling, compression, class 4 laser, gentle mobilization, decrease the swelling. What could you do?
Like what?
I don't know. What can you do to help with this?
Well,
Besides price.
I don't know. I mean, I'm on it all day, so I'm not really following good protocol, but I'm keeping it mobile. I'm not moving it, which I think is important. But
okay, so complete isolation of movement isn't necessary in most cases of a strain like this. You want to protect it so you don't overstretch that tissue again, but you should be moving the ankle. A lot of people tend to like, nothing. Nope. Putting my feet up on the couch. 2 weeks, I'm out. No, we want to get movement into that tissue as quickly as we can according to how you're responding. So that's really, really healthy to have. Honestly, being on your feet is probably more helpful than laying down around all day, especially after a day or two after the injury, okay?
Yep.
You might feel a little sore towards the end of the day just because you're stressing some tissue that's already inflamed, but it's healthy in the long run.
Yesterday it was hurting quite a bit.
When did you do it?
Saturday was bad, like during the night. Sunday, I rested it in the morning, and then I walked, and it was okay. It wasn't terrible. It was better with a shoe on.
Yep.
And then even yesterday morning wasn't terrible until at the end of the day after being on it all day long. That was pretty tender. I hope you just got that on my face.
That was a nice face. The tibialis anterior face.
Yeah. And that didn't hurt until today.
This muscle?
Yeah.
Oh, another clinical question or topic. Ankle sprains. So the severity of the ankle sprain. You're going to see hematoma with very severe cases, especially pooling of blood in this tissue here. She doesn't have that, which is good.
Mm-hmm.
So we're going to go towards grade 1, right? Grade 1, 2, and 3 are a little bit more spread out in terms of the ligamentous strain. And muscles, it's a little bit bigger of a jump with 2 to 1.
Right.
Okay? So grade 1, you won't see as much hematoma forming. You won't see as much swelling. She doesn't have a ton of swelling. Grade 1, you won't have an increased laxity in the joint. So you'll still have a less than 10%, I believe, of fiber tearing in a grade 1. In grade 2, you'll have partial tearing. You'll still have stability. I have a little strand left on this ligament for me. One strand.
Gosh, no.
I'm pushing to 3. But there's a lot of things that help support and stabilize your ankle here, and a lot of muscles as well. So that's the good thing. You can get tears in certain things and recover from them. You know, everything's just because you have a tear, people are like, oh, surgery. No, not all the time, really.
Like I didn't bruise. It really didn't swell too terrible. I didn't notice swelling until yesterday evening.
Yeah.
After being on it all day, it really didn't swell.
Severe ankle sprains, you'll get a lot of pain up the shin. You'll get pain on the posterior aspect in these ligaments back here, because the ankle bone shears so much across. So not only does it pull on this tissue here, but it injures the backside of the tissue here. Yeah. So we can look at that. There's certain orthopedic tests you could do when you're looking at this type of a problem. If it's more severe and you need some more diagnostic imaging, a diagnostic ultrasound, it can be helpful. It's a very affordable and quick and effective and efficient way of looking at these tissues to see how much tearing we have. But really, in most cases, an exam, a history, and a response to treatment gives us a lot more information than we need with imaging, right? So we continue to support her with dry needling over this ligament that she strained, calcaneofibular ligament that she strained. We continue to do laser mobilization, and then when she's starting to feel a little bit better, I'll start to adjust her midfoot and her knee and her hip. If she's limping a lot, her low back can compensate. So it's helpful to get those areas worked on if we have those tools available to us. But for this tissue here, heat, smart resting with ice and elevation can help with pain and swelling, and then good dietary control, and making sure that you start to move it as soon as you can.
Yep.
Grade 1 ligament strain.
Okay, that's all it is.
Peace.
Peace.